Hello. So today, me and my group mates, Sandy and Navedita, we're gonna talk about the Arestin-Periodontal Therapy. And I'm also hoping that we all have a little bit of idea about the Arestin by now. But let's start with its history part first. Arestin. So it was invented in 1980 by a periodontist named Dr. Gary Gerberg, and Arestin's development took a long time, which was 21 years. So the generic name is minocycline hydrochloride, and the brand name is known as by Arestin. And Arestin is the only antibiotic that helps in treating the gum disease by the local delivery of it to the site of the infection. So, before talking about the therapy itself, let's talk about the periodontal disease, as this is the reason that there could be a need of that therapy to be done. So, we all know the gum diseases are the bacterial infection of gums and its supporting tissues. Supporting tissue includes the periodontal ligament fibers, teeth, and bone. Periodontal disease is the cause of adult tooth loss in the United States, and the statistics also show that 3 out of every 4 US adults develop a type of gum disease. So now comes the what are the causes, symptoms, and treatment of those periodontal disease. So the cause for the periodontal disease could be one of these plaque bacteria, and that bacteria could cause inflammation and then infection, which leads to periodontal disease. And another contributing factors are also existing, which are smoking, poor oral hygiene, genetics, certain medical conditions. Symptoms include you might have a bleeding gums, you might experience bad breath, and there might be a swollen or gingiva and tender gums, loose teeth. And after looking at these causes and symptoms, what are the available treatment for these diseases? So that comes to scaling and root planning, antibiotics, surgery, which is for severe cases, like if the disease is like really severe. So in those cases, we prefer surgeries. And Arestin is a minimal invasive therapy to treat those periodontal diseases.
Arestin is a locally applied antibiotic. So, what are the three indications of Arestin? Chronic periodontitis, ejective scaling and root planing, and periodontal maintenance. Arestin is used in conjunction with SRP to target specific periodontal pathogens below the gum line. It is a locally applied antibiotic which remains active in the pocket and it reduces the pocket depth. Periodontal disease is an infection. Arestin at the time of SRP helps arrest the progression of infection right from the start. So what it actually does, it can effectively debride the root surface and release the minus cyclin in periodontal pocket, which will reduce the pocket depths. Arestin can be used during the maintenance visits if periodontal pockets with signs of disease actively are detected. So in this slide, I'm going to talk about how Arestin and SRP works together. So what your dental professional will be doing, they'll be removing the plaque and tartar from the gum line and beneath the gum line as well with SRP, that's scaling and root planning. And then the Arestin microspheres are placed into the infected pockets using a special plastic applicator. So there's a syringe and there's the minus minocycline is inside the syringe. And with the help of that syringe, we place it around the gum line and the aminocycline is released and it's in a powder form. So once it goes under the gum line, the antibiotic is released over time, helping to reduce bacteria as the gums heal. If the untreated periodontal infection is left inside the mouth, it can lead to increase in the pocket depth. The pathogens may corrupt normal immune response, which helps harmful bacteria survive and multiply, and then the infection persists and even worsen. SRP alone may not help in sustain harmful bacteria, It may be difficult to access deep-seated bacteria with the scaler, so harmful bacteria left behind tends to recolonize. But Arestin and SRP, if worked together, they can reduce gum pocket depth by 40% or more. It can reduce harmful bacteria by nearly 2 times more, and it can also reduce gum bleeding during examination nearly 2 times more effectively. The reason Arestin works differently with SRP is because of its microsphere delivery in the gum. The sustained release of minocycline, which is a broad spectrum antibiotic which targets the infection, it starts as a fine powder, making it easy at the base of the pocket. Once inserted, it can contact the gingival crevicular fluid, which begins to hydrolyze the biospheres. So, for example, if there's a pocket depth of 4 millimeter or more, it means there's an infection. But if the pocket depth of 7 millimeter or more is there, it means it's like a permanent risk of damage, and definitely Arestin and SRP should be um, done for that area. Benefits of Arestin therapy. So they're proven effective in reducing gum pocket depth and improving the oral health. It is cost effective as well, minimally invasive procedure with a low risk of side effects, often covered by insurance and possibly more cost effective than traditional surgery. So as we've talked in the previous slide, Arestin and SRP together works great. They have better benefits as compared to SRP alone. So Arestin and SRP, they have greater 58% greater pocket depth reduction for cardiovascular disease people. And in cases of people who smoke, there's 29% greater pocket depth reduction as compared to SRP alone. And people who are over the age of 50, there's a 33% greater pocket depth reduction as compared to SRP alone. So definitely the studies prove that Arestin, if worked with SRP, it has more benefits as compared to Arestin or SRP if worked alone under gum diseases.
When is Arestin effective? For 1 month, target periodontal bacteria. For 3 months, pocket reduction remarkably versus SRP alone. So when treating periodontal disease, both pieces are essential. SRP and Arestin. For 9 months, maintaining reduced pockets. Contraindication for Arestin: if you are allergic to minocycline, during tooth development or chances of getting permanent teeth discoloration, and if the immune system is weak, autoimmune syndrome if used, characterizing by swelling, fever, joint and muscle pain, also rashes. Side effects are cold and hot sensitivity, gum soreness, and toothache. Success rates for Arestin. So Arestin therapy has been shown to be effective in treating gum disease and reducing pocket depth in the gums. Long-term outcomes for Arestin. Patients who receive Arestin therapy and follow good oral hygiene practices can expect to enjoy improved oral health in the long term.
For appropriate periodontal patients, administering Arestin at the time of scaling and root planing, or SRP, provides comprehensive treatment for greater pocket depth reduction than SRP alone. Arestin comes in ready-to-use single-dose cartridges that do not require pre-measuring or pre-mixing and are administered with a stainless steel dispensing mechanism specifically designed for this purpose. A new cartridge is used for each periodontal pocket, so the number of cartridges needed depends on the size, shape, and number of pockets to be treated. Arestin immediately bioadheres and gradually bioresorbs over time, so removal is unnecessary. Using Arestin is a simple three-step process. Assemble the unit by inserting an Arestin cartridge into the handle, then twisting until you hear it click into place. Remove the cap. Position the cartridge tip without force into the base of the periodontal pocket, keeping the tip parallel to the tooth's long axis. Press the thumb ring as you pull the tip slowly away from the base of the pocket to evenly dispense all of the Arestin. To discard the spent cartridge, retract the thumb ring and remove it. Then either insert a new cartridge to continue treatment or sterilize the handle so it's ready to use for the next appropriate periodontal patient. For millions of adult Americans, periodontitis is a progressive and chronic disease. The disease begins with an unhealthy balance of bacteria that colonize within dental biofilm. The most prominent periodontal pathogens are P. gingivalis, T. denticola, and T. forsythia, collectively known as red complex bacteria. Research suggests some periodontal pathogens may corrupt the normal immune response, helping harmful bacteria survive and multiply, and the infection to persist and even worsen. Left untreated, a periodontal infection can contribute to increasing pocket depth. SRP alone may not achieve and sustain a healthier balance of bacteria. It may be difficult to access deep-seated bacteria with a scaler, and harmful bacteria left behind tend to recolonize quickly, potentially returning to baseline levels within a few days. When indicated, recommend a comprehensive treatment plan that includes both SRP and a locally administered antibiotic or LAA, like Arestin, for the treatment of adult periodontitis. Clinical studies have shown that administering Arestin achieves greater pocket depth reduction than SRP alone. Arestin works differently than other LAAs with its microsphere delivery system. Arestin provides sustained-release minocycline, a broad-spectrum antibiotic that targets infection. Arestin starts as a fine powder, making it easy to deposit at the base of periodontal pockets. Once inserted, contact with gingival crevicular fluid begins to hydrolyze the microspheres so they immediately bioadhere. As hydrolyzation continues, water-filled channels form inside the microspheres. The minocycline inside gradually dissolves and diffuses through these channels into the surrounding tissues to achieve and maintain a therapeutic level of minocycline well above what's required to kill periodontal pathogens, and can remain active in the periodontal pocket for up to 14 days. Over time, the microspheres will completely bioresorb, leaving behind a healthier balance of bacteria and a greater reduction in pocket depth than with SRP alone.
Following Arestin therapy, we recommend to wait for at least 10 days to start using interdental cleaning aids. For a week, avoid touching treated areas and eat nothing crunchy, hard, or sticky. For a week. That was all for our presentation today. Thank you for listening.